Hello, welcome to Stroke Tips. We're going to talk about imaging in acute stroke. NeuroTips is for medical professionals, and we provide useful information within a few minutes. At the emergency room, when acute stroke is suspected, a CT scan of the head should be done without contrast as soon as possible to check for any sign of a bleeding. But remember that when the CT scan is negative, it does not rule out a stroke, and acute stroke will not show up on a CT scan. If TPA is not indicated, we can go ahead and get the CTA of the head and neck to look at the blood vessels going to the brain and to check for any sign of a large artery occlusion or high-grade stenosis. And if there's any signs of a high-grade stenosis or the occlusion of the large artery, we can consider calling the stroke interventionist. If TPA is indicated, we should go ahead and give TPA as soon as possible. We can get the CTA later on. Do not delay TPA to try to get the CTA done. CTA can be done to check for the blood vessels, but it does need IV contrast. It's contraindicated for a patient with kidney disease. MRA can be done without contrast, but it usually cannot be done on an urgent basis. And it also needs patient cooperation and make sure there's no sign of any metal in the body. MRI scan is usually done later, and it can better define the extent of stroke even in the acute stage. And we usually try to perform the MRI after the patient is more stabilized. On the right-hand side is the MRI scan, and it shows a stroke as where the arrow is pointing to. For post-TPA patient, they do need a 24-hour CT scan to check for any sign of a bleeding before starting patient on any antiplatelet agent. Thank you for your attention, and we'll see you again soon.